So we're going to talk about the way in which the blood flows through the heart today. There are four main chambers of your heart. You're going to have a right atrium, a right ventricle, a left atrium, and a left ventricle. And these are going to be responsible for propelling the blood through the heart. So you're going to have deoxygenated blood that comes into the heart that's going to go out into the lungs to become oxygenated, come back to the heart to send that oxygenated blood out into the body's tissues. So we have an unlabeled diagram that we're going to use to show you the way in which blood flows through the heart. So first, your deoxygenated blood is going to come through the superior vena cava as well as the inferior vena cava into the right atrium. So once the blood is in the right atrium, it's going to be propelled through the tricuspid valve into the left ventricle. The tricuspid valve is going to have three lobes that are going to pinch together to prevent any backflow of blood from the right ventricle back into the atrium. So once the blood is securely in the ventricle, it's going to go through the pulmonary valve, out through the pulmonary arteries to the lungs to become oxygenated. Now once the blood is oxygenated, it's going to come back to the heart through the pulmonary veins into the left atrium. Once in the left atrium, the blood is then going to flow through the mitral valve or the bicuspid valve into the left ventricle. So the bicuspid valve has two lobes that are going to pinch together, which are going to prevent backflow of any blood from the left ventricle into the left atrium. So once that blood is securely in the left ventricle, it's going to propel itself up through the aortic valve into the aorta, where it'll then be sent out into the tissues of the body. And the tissues of the body are going to use up the oxygenated blood, and they're going to return the deoxygenated blood back to the heart to get oxygenated again through the superior vena cava as well as the inferior vena cava. And the entire circulation of the heart is going to continue again. It's going to continue like this as long as you're alive to propel that oxygenated blood to the tissues of your body.